Hi all, welcome to StudyMEDIC, Study MRCEM OSCE MMA series. Today we'll be dealing with wound care, suturing and local anesthesia techniques. First we'll start with suturing. Suturing is a very important station and there is high chance that it will come in for your exam. And in suturing station, it is one station where you will definitely have to do the procedure. You will have to put at least 2 simple sutures. Ensure that you don't touch the needle with your hand. It should be a non-touch technique. You can use forceps needle holder. Don't touch the needle with your hand. Okay. We'll be dealing with every procedure, every stations as pre-procedure, procedure, post-procedure. Pre-procedure will be discussing the indications, contraindications, complications, how to prevent the complications. In the procedure, we'll be dealing with how to prepare the patient, preparing ourselves, how to prepare the equipments, how to do the procedure. Post-procedure will be dealing with post-procedure management, documentation, advice, and follow-up. The station can come in different ways. Sometimes it can be you and an examiner with a mannequin. It can be you, a junior doctor, and a mannequin. You'll have to teach the junior doctor. Sometimes it can be a patient itself where you have to do the procedure in the patient. Depending on the station, you'll have to change the way you verbalize, because to the patient you can't tell in medical terms, whereas to a junior doctor you can tell everything in medical terms itself. We'll be helping you prepare very well for these things. In our live session, we'll be dealing with different stations. Indications for suturing are big wound, gapping, and deep wound which needs suturing for closure. Contraindications for suturing are grossly contaminated wounds, devitalized or ischemic wounded, uncontrolled bleeding, or neurovascular injury. Complications can be infection, scarring, bleeding, allergy, pain, local anesthesia toxicity. How will we prevent the complications? By using strict aseptic precautions, proper technique, giving him pain medication, correct and accurate dosage of local anesthetic, reduce the dose in extremes of ages, and injecting local anesthesia by aspiration, then injection, aspiration, injection. And if there is any local anesthesia toxicity, we'll be prepared how to treat the patient. We'll move him to the resuscitation area, connect him to the give him oxygen, IV fluids, and if there is any problem, we'll prepare intralipid as well. We'll have to ensure that intralipid everything is prepared, so that if the worst scenario arises, we are prepared to deal with it. Then we'll move on to the procedure, how to position the patient. Expose the area, keep it on the surface. Then we'll prepare the equipment. Then we'll wash our hands, clean hands, wear gloves and PPE. Then we'll position the patient, clean the area, dry the area. Suture using no-touch technique. We can use the forceps and needle. With the forceps, we'll hold one edge of the wound, and with the needle holder, we'll hold the needle. Ensure that you don't touch the needle with your hand at all. Then we'll insert from one edge. Either you can go insert in one edge and come out through the other edge, or else you can insert through one edge, come out, then with the forceps hold the other edge, again put a bite, and we have to do at least 2 simple sutures. This is the thing. At least 2 simple sutures you have to do. So you'll have a 8-minute station. Within that, you have to verbalize these things. You have to do at least 2 simple sutures. Okay. After that, putting the suture, we'll dispose the sharps in the correct bin, dispose the gloves and apron. Then we'll document the procedure and give the patient post-procedure advice. Post-procedure advice, how will we care for the suture, when to remove the suture, what are the things to be done. This has to be explained. And in every station, initially we'll have to greet the patient and greet this and introduce ourselves. That is must in every station, whether it's procedure, history taking, everything. Any station, introduction is very important. And to greet the patient, good morning, good afternoon, whichever it is, like that. Now, wound care. Wound care, it's a newer kind of station which has come in the exam for the last few OSCEs. Since it's a different kind of station, wound care, we'll have to explain how the wound care is. And in case of suturing, one thing I forgot to mention is that we'll have to ensure that there is no neurovascular injury. We'll have to examine the patient, examine the movements, sensations, to ensure that there is no neurovascular injury. Any nerve injury or tendon injury or any vessel injury, we have to ensure. We have to ensure there is nothing like that. Usually it won't be there in suturing station, but we have to examine it. Then only they will know that we are looking for it. In wound care station, we'll introduction, and then we'll tell to the patient that I will assess your wound, clean it and dress it to reduce infection and help healing. This is what we are going to do and why we are doing it. Then we'll take an ample history from patient. Ample history means we'll ask him any allergies, past medications, past history, last meal, events dealing to the, how did this happen. Then we'll ask him, how are you now? Do you have any pain? This actually you have to ask it initially itself. We'll introduce and then we'll ask, how are you? Do you have any pain? Should I offer you a pain medication? If he's telling he's having his pain is okay, then it's fine. Now, after the ample history, you can ask him again, how is your pain? I'm going to examine you. Should I give you a local anesthetic so that you don't feel it? Then, if it is feeling for a local anesthetic, we can give a local anesthetic. Before giving the local anesthetic, we have to verbalize how we are going to give, what we are going to give, and the dosage and all. Then we position the patient and expose the wound. In every wound care, it is very important to look, feel, and move. Look, why will we look? Looking is the inspection part. Look for the location of the wound, size, any bleeding or clot, contamination, wound edges, signs of infection, if there is any erythema, pus, whether the wound is contaminated like that. Once we finish our inspection, we'll go into palpation. If there is any tenderness, warmth, crepitus, we'll palpate the distal pulses, capillary refill, and sensation. Then we'll move the patient. Move the, means if it's an arm, we'll try to move the hand, ask him to move the hand to rule out any tendon injury or nerve injury. Then coming to the wound cleaning, we'll use normal saline using a 20 ml or 50 ml syringe without needle. We will irrigate copiously using at least 100 to 250 ml for small wounds and more if contaminated. This is the minimum amount you should use. Irrigate copiously, minimum 100 ml you should use. Even if it's a small wound, you must use minimum 100 ml to ensure that it's clean. Then clean the skin around the wound with chlorhexidine or povidone iodine. For around the wound, we'll clean with chlorhexidine or povidone iodine. Inside the wound, we are cleaning only with normal saline. In your hospital, you might be using betadine or something, but according to the UK guidelines, inside the wound, we'll clean with normal saline. Around the wound, we can clean with chlorhexidine or povidone iodine. We'll clean from inside to out. If this is the wound, we'll clean from inside to outside. If there is any dead tissue, clots, or contaminants, we'll remove it using sterile forceps. And if we have to cut any tissues, we'll cut it using blade. If we have not given the local anesthetic, ensure that ask the patient frequently, how are you now? Are you feeling any pain? Okay. Then we'll proceed with immediate closure. If it is a clean wound, less than 6 hours, no infection, we can do suturing and close the wound if needed. If it is a contaminated wound or a bite wound or crush injury, we'll wait for delayed primary closure. Highly contaminated and old infected wound, we'll leave open. Then we'll apply dressing. Apply non-adherent dressing. Paraffin gauze dressing we can give. Tegoderm or Jello ET. Sterile gauze secured with tape. After that, we can ask him, initially itself, we should ask him about his tetanus prophylaxis. When has he taken his tetanus vaccines and all. Tetanus prophylaxis is very important for the exam. You have to be thorough with the chart where when should be tetanus injection given. If the last dose is taken 10 years ago, if the last dose is taken last month, or if he has fully vaccinated and if it's a contaminated wound, what should be done. This thing you have to be thorough. And if it is a bite wound or a contaminated deep wounds, we'll give antibiotic. We'll dispose the shark, advise patient, and then document the procedure. Moving to the local anesthesia technique. Local Sheji! Jilne? Oh, yeah. ഇച്ചിപ്പം വരാ ഒരു 5 മിനിറ്റ് പോയി സെജിന്റെ അടുത്ത് പോ ജെല്ലിനെ എടാ ഈടെ ഒരു 2 മിനിറ്റ് നീ നോക്കിട്ട് കട്ട് ചെയ്യണേ കേട്ടാ നീ മറക്കല്ലേ ലാസ്റ്റ് ഇതൊന്ന് അപ്ലോഡ് ചെയ്തത് ഓക്കെ Moving on to the last topic of the session, local anesthesia technique. It is also very important. In this session, we'll greet the nurse and request to bring the required equipments. We'll do an introduction and consent. Introduction is very important in any session. We'll say, hello, hi, good morning. I'm Dr. So-and-so. I'm the emergency registrar. May I know your name and age, please? Nice to meet you. How are you today? What brings you today, or what do you want? I believe you have something to discuss with me regarding the local anesthesia technique. How much do you know so far? These are the things that you can ask if it is a junior doctor or nurse who has come to learn this procedure. Okay. If it is to a patient, then the things are different. We'll do like this. I will ask the patient, "Hi, I am doctor this and so. How are you? I believe you have some pain. I am here to give you local anesthesia. This is to reduce your pain. Before proceeding to giving local anesthesia, I have to ensure that you don't have any contraindications to receive local anesthesia. So I have to take some data from you, uh, and then we have to explain to the patient that how we'll take an ample history, ask him about the allergy, medications, past history, last meal, and events relating to this. Then we'll be explain him the complications. These are the complications that can arise from this procedure, and we'll explain him how will we prevent the complication. After that, we'll ask the patient, "Are you okay to go ahead with the procedure?" This is how we take the consent. The complications can be pain, bleeding, infection, local anesthesia, toxicity. To prevent the complications, for plain lidocaine, the dose is 3 mg per kg, maximum 200 mg. For lidocaine with adrenaline, dosage 7 mg per kg, maximum 500 mg. Then we'll explain the procedure. We'll expose the area, clean the area, drape the area. If there is any local anesthesia toxicity, like the patient is having local anesthesia toxicity, we'll stop the procedure, move the patient to a resuscitation area, give him high flow oxygen, IV fluids, and prepare intralipid. If he goes into RS, we'll give him intralipid. Then how will we give the local anesthetic? We'll clean the area, drape the area, insert the needle, then we'll aspirate, ensure it's not blood, then we'll inject slowly, then we will throw slightly, aspirate again, then inject again. We'll wait for 2 to 3 minutes and check whether the area is numb. Once the area is numb, we can go ahead with the procedure. In case of local anesthesia, other things we have to mention is that in extremes of ages, we'll reduce the dosages. And when using lidocaine with adrenaline, in areas where there is end artery, we can't give lidocaine with adrenaline. It can go into gangrene like fingers, toes, ear lobule. Here you can't use lidocaine with adrenaline because it will cause vasoconstriction and can cause gangrene in that area. These are the thing about local anesthesia technique. It can sometimes local anesthesia can come as an individual station or in a suturing station. They can ask you about local anesthesia. Local anesthesia is very important because you will have to explain it in most of the procedure stations. What is the local anesthesia you are giving? What is the dosages? Okay, that's for today. I hope you guys found it useful. If you have any doubt, you can contact us at StudyMEDIC. We'll help you with the complete preparation for your study MRCM exam. All the best for the exam. Thank you.